Tips to self-treat hip bursitis. Tip 1. Rest. Rest would indicate stopping all running activity for a period of time and tapering down from your regular exercise activity and any activity that worsens your symptoms. You should not return to running until you can be pain-free throughout the day. Tip 2. Ice. Hip bursitis is usually due to overuse, which causes the inflammatory process. Typically apply ice to the lateral part of the hip over and near the greater trochanter, but place it on your most painful location, yes. The rule for icing is to apply ice no more than 20 minutes per hour. Do not place the ice directly against the skin, especially if you are using a gel pack style. Tip 3. Reduce training volume. Initially, discontinue running and any other aggravating factor until you can be pain-free throughout the day. It's important to reduce the training volume and intensity in order to allow the tissue time to heal as you adequately rehabilitate. Be particularly cautious by reducing activities for at least a few weeks as you rehabilitate. Tip 4. Anti-inflammatories. Consider speaking with your medical professional about a short course of anti-inflammatory medication to help speed up your recovery. Tip 5. Improve your mobility. Mobility issues and myofascial restrictions are highly correlated with hip bursitis. Tightness in the IT band, or in the deep hip internal or external rotators, is a contributing factor. Use self-mobilization techniques to work on the areas above, below, and around the painful area. Avoid the painful area as it tends to be too inflamed and bony to be easily or effectively self-mobilized. Tip 6. Kinesiological taping. The purpose of the tape is to help support the tissue and aid in lymphatic drainage. It can also possibly help with kinesthetic awareness to ensure proper mechanics. Tip 7. Strengthen your hip muscles. This is usually the most important component of your rehabilitation and for prevention long-term. Core muscle weakness can also be associated with hip bursitis. Tip 8. Check your shoes. Your shoes may be worn out and may be the cause of the pain. If you wear a shoe that helps to limit overpronation, remember that the inner cushion and structure of the shoe can wear out before its outer appearance. Tip 9. Have your gait analyzed while running. Gait or running abnormalities can increase your risk of developing hip bursitis. Click the link below or follow this link https://askthenursexpert.com/category/bursitis for more tips to self-treat hip bursitis.